The cause and effect relationship between mental health and fertility has been an ongoing discussion. Here are a few important points that everybody should know. This is Dr. Mamta Dighe, Director, Xenith IVF Fertility Centre in Pune. So, infertility is a condition which affects approximately 15% of all couples in the reproductive age group, and it is only increasing, as we all know, which means that the impact of infertility affects quite a lot of people. Having been into infertility practice exclusively since the last 22 years, and amongst the first few board certified reproductive medicine specialists in the country, I have seen scores, thousands of infertile couples and seen the impact of infertility on mental health and relationship amongst them. It is not just a personal experience, but there is enough data to show that the incidence of depression and anxiety is much more in infertile couples compared to the general fertile population. In fact, if you look at the infertile population, we can see an incidence of approximately 15 to 50% of depression in these couples and an incidence of anxiety close to anywhere between 8 to 28%, which is much higher compared to what you would see in the general population or the fertile population, which means there is some kind of an effect or toll that infertility is having on the mental health and well-being of these couples. Like we all know, we are a whole. In fact, the term health comes from the word whole. So there is something obviously impacting. It's not just the burden of the infertility, but sometimes even the treatments and the burden of failed treatments, which is also affecting the mental health. A lot of women who are infertile experience symptoms of low self-worth, guilt, shame, outbursts of anger, at times even jealousy, and social isolation. Distress in the mental health is seen more commonly in women compared to males. Amongst the couples, amongst the infertile couples, it has also been seen that when it comes to male infertility causes, when there are couples where the cause is related to the male factor, similar amount of distress is seen even amongst the males, which can also lead to issues of a low self-worth and difficulty in relationship problems, intercourse, and many other things. Therefore, infertility is an area which is causing a lot of mental issues or difficulty in the well-being and the mental health amongst couples. It is not just the infertility that is causing this. In fact, it has been studied that even the impact of treatment, of failed treatments, can increase the risk of increasing anxiety or depression amongst these couples. In fact, even in countries where the whole treatment is sponsored by state and hence the impact of financial burden is not borne by the couples, even in such countries it has been seen that there is a high dropout rate in the treatment after previous treatment failures, which means that even when couples do not have to bear the financial burden of treatment, it sometimes becomes very difficult to bear the psychological burden of failed treatments. Hence, not only is it important to make sure that we utilize methods to improve success rates, but we also make sure that there is a way to handle the impact of this burden of loss of wellness, mental wellness, which is affecting the couples. This is one factor, but an often less looked at factor is also, is there an impact of mental illness or psychological illness and distress on infertility? That means, can a psychological problem, depression, anxiety, lead to infertility? Much data is not available on this. However, a study on 58 women conducted in the United States showed that there was a twofold increase in infertility in women who were suffering from some major psychological problems. Now, whether this was only as a cause or an effect of the psychological distress, or was it related to other confounding factors which could be associated with a depressed state, such as increase in BMI, loss of libido, substance abuse, increased rate of alcohol, increased cigarette smoking? How these were influencing the infertility, the impact of these confounding factors could not really be seen, but in some or the other way, there is an impact of a psychological issue also on reproductive health. So there is a two-way, like we said, that we are a whole. What happens in one part sometimes does get conveyed to the other part. So whether it is the impact of infertility on mental well-being, or whether it is the impact of psychological problems in causing or being the cause of infertility, there is some relationship between mental health and infertility. Hence, it is extremely imperative that we address this issue today. With globalization, with increasing amount of social media usage, there is increasing mental health issue globally, and we are all aware of that. In fact, there are some who say that after the pandemic of COVID, the next pandemic is going to be that of mental health. And hence, each specialty in their own right should make some attempt to try and address the other issues and the other impacts of the primary problem and its effect on other issues such as mental health. This is one point that I wanted to bring out today, especially in this month, which is dedicated for mental health. And we at Xenith are trying to look at, if you go to our YouTube channel, you will see many videos on diet, on yoga, on even meditation practices, because we really feel that this has to be addressed as a whole, and it is very important for centers to address the impact that it causes even on the treatment success. And that's the last point that I want to get to, is that it's not only the impact or what infertility causes on mental health, what psychological issues and how they can cause infertility, how the burden of treatment can add to mental anguish, but it is also important to address that if we do not take care of the stress levels, if we do not take care of the anxiety, it could also result in decreased success rates after treatment. So it's like a whole, and it's like a vicious cycle. So we need to intervene at every point, and what better than to take care of our own mental health and address them as soon as possible. So definitely these are a few points that I wanted to address today. And the next point is, how do we actually take care of this? There are 2 points. One is to take care at our own levels. Again, I definitely would urge you to look at many of our other, YouTube videos and blogs, especially blogs where we've written a whole lot about how you can address these issues. And I think every couple should definitely, this is the base, frankly, should, go through all these before they embark on the journey of treatment of infertility. And the second is also, I think that as a center, if we can address these issues, maybe through counseling, maybe through the right foods, because trust me, your gut health is definitely associated with your mental health. With the right type of maybe yogic practices, maybe meditation, and so many other healing techniques that are available. Also, trying to understand how couples can bond together, how families can bond together, and help them, go through this journey, a difficult journey in their life which they have decided to embark on, and form kind of a support system around them. This is what is finally not only going to help them achieve the dream of parenthood, but make sure that the journey has been less arduous and has been a wonderful journey in itself. So I hope this video has shed some light on the impact of infertility on mental health, on the cause and effect relationship between psychological disorders on fertility, and how all of us can come together and address this situation together. Thank you so much, and definitely please do subscribe our handles, all our social media handles, and definitely please do look at our blogs, especially on diet, yoga, and tips on how to decrease stress in infertility and during treatment. Thank you, and signing off. Bye-bye.